Look, we have received already thousands of comments from you guys on this next topic. The tabling of a draft bill in the Australian Senate has reignited the euthanasia debate. The bill is the work of Greens Senator and former GP Richard Di Natale.
Under the proposal, 2 doctors and a psychiatrist would have to sign off on the prescription of a lethal drug to people with a terminal illness. Joining us to discuss this complex and, of course, highly emotive issue is Senator Di Natale and Professor Courtney Campbell from Oregon State University in the US, Oregon being one of the states that has implemented the so-called death with dignity laws. Good morning to you both. Now, Senator, firstly to you. There have been several attempts to go down this track in Australia in the past without success. What is the difference now? What's different about your bill? Is it legislatively significantly different to previous bills?
Well, I suppose the first thing to say is that we have actually implemented these laws in Australia previously in the Northern Territory. In fact, several people used those laws in the 1990s. They were overturned by the federal government under the Howard Prime Ministership at the time. So we have had those laws in place. This bill provides a number of protections. You'd need to see 2 doctors and then you would need to have a mental health assessment by a mental health professional to ensure that you're not suffering from something like clinical depression. There are a lot of safeguards in place, and ultimately I think the reason for introducing them now is that the debate's moved on in this country. We've seen these laws in operation in a number of places around the world. They've been operating effectively, and the Australian public are really demanding that we move in this area. And, you know, in politics it's easy to sit back and not show a bit of courage, but I think in this area politicians need to show some courage and respect the wishes of the Australian community who want the choice, who really just want the choice to be able to die with dignity, to say goodbye to their family and friends, and do so at the time of their choosing.
Yes, Senator, we're certainly seeing that reflected in some comments from our viewers this morning from Hannah Fitzpatrick. She watched her grandmother die without dignity, currently watching her friend die of motor neurons disease. Another from Sharon, 20 years of working in aged care, it's time for a change. I'm just interested to know from your experience as a GP, what makes you so passionate about this issue?
Look, it's something I had to think about very deeply because, you know, the instinct for a doctor is to try and preserve human life. But your overriding responsibility is to relieve people of pain and suffering. And in the end, it's only patients themselves who can decide that. And so I think with the appropriate safeguards, to give people the dignity that they want for themselves, to be able to say goodbye at home, not in a hospital bed with tubes coming out of them, losing control of their bodily functions, in pain, sometimes lying in a pool of their own secretions, drowning and gasping for air. And people say to me, that's not how I want to die. And more importantly, just having the option when you're diagnosed with a terminal illness, just having the option gives you the sense of comfort to know that when the time does come, you're going to have some control and you're going to be able to say goodbye in the way that you want to say goodbye. So in the end, I mean, seeing those people, listening to those stories and being really, I suppose, guided by that ethic of it's a patient's right to be able to decide when they want their pain and suffering to end.
Professor Campbell, you're very well versed in this subject, and your state of Oregon, as I mentioned, has the Death with Dignity Act, which has been in law now for 17 years. How does it work? What are the requirements? What are the safeguards?
Well, as indicated in Australia, you have 2 physicians. They must make a diagnosis that the person is terminally ill, which means under Oregon law that they have 6 months or less to live. There's no requirement for psychological evaluation unless the physicians deem the individual to be suffering from impaired judgment or depression. You have to have a certain amount of waiting period. You have to wait 15 days prior to or after the initiation of your request before you're able to receive the medication. You also must be at least 18 years of age, and you need to be a resident of the state of Oregon, which is different than, as I understand, the Australian law, which would make this a federal right In Oregon, it's a state right, not a federal right.
Have you seen much? Sorry.
Sorry, Professor, I just wanted to know, one of the requirements is that the patient must be able to administer the drug to themselves, thus not implicating anyone else in their death. You know, for many patients, that might be physically impossible by the time they reach the stage that they feel they want to die with dignity.
Yes, that's quite correct. The law requires self-administration by the patient. There are discussions in Oregon as well as elsewhere that may make it difficult for, say, patients with ALS or Lou Gehrig's disease to self-administer. So there are real questions about the process of self-administration. At what point can a physician provide administration to the patient?
Have you seen much abuse of the system in the US, in Oregon?
Not really in Oregon. The state law requires so much oversight and regulation and reporting on the part of doctors that it's been very well controlled. One of the concerns before the law was passed was that there would be a lot of abuse, a lot of angels of mercy, so to speak, and that just really hasn't transpired.
Senator, have you consulted, I mean, Dr. Philip Nitschke, for example, is one person who's been very vocal on this issue. Have you consulted him in your plans? And do you think you'll be successful?
We've consulted a number of people, but it's important to remember that the legislation really is an exposure draft. We want to get as much feedback as we can. We want to get feedback from the medical community, from the legal community, and we're prepared to make modifications to the legislation in order to get broad support. I've spoken to
one of those modifications, Senator, might be the notion that the government pays for the service. I imagine that's going to be very difficult to get past a lot of people.
Yes, look, there are a number of things to think about with the legislation, but we know it's operating in a number of places around the world, and so none of those are insurmountable. I want to build, I don't think we're going to get this legislation through if it's a partisan issue. We've got to try and take the politics out of it. I want it to be a conscience vote for all sides of politics. Obviously the Greens support the legislation, and I'll be doing everything I can to build that support. But the key here is to try and work with those people, and a number of them have approached me, politicians in the parliament, who said, at least privately, we think this legislation is long overdue. We want to give people the choice, and we want to work with you to try and make it happen.
Well, if our soapbox is anything to go by, Senator, it is going to be another round of very rigorous debate, which is precisely what you've been after. So thank you very much for joining us this morning. And, Professor, thank you for your time joining us from Oregon this morning.
Thank you.
It's such an emotive issue. I think a conscious vote would actually be a really good idea, because then the politicians can draw on their own personal experience. Some of the emails coming through about what people have gone through seeing a relative die is just heartbreaking.
Yes, indeed. And it does, I mean, it opens a huge philosophical question about what really constitutes dignity, and does battling against suffering I mean, is that an essential part of the human condition?
Yeah.
Does that ultimately add to dignity? I mean, it's a massive debate.
Yeah, you just feel so helpless sometimes.